Still on unmet demands, but this time in the health sector, as the Nigerian Association of Resident Doctors has given the federal government a new 30-day ultimatum to address outstanding welfare and policy issues affecting its members, including unpaid salary arrears, promotion entitlements, and the reinstatement of sacked doctors. The ultimatum was contained in a communique signed by NARD's President, Dr. Mohammad Suleiman, and also the Secretary General, Dr. Shuaibu Ibrahim, and the Publicity and Social Secretary, Dr. Abdulmajid Ibrahim, at the close of the association's 45th Annual General Meeting and Scientific Conference, which was held in Katsina State between September 21st and 22nd, or rather 26th, I beg your pardon. Now, the meeting themed mitigating health worker migration through extra remuneration incentives, a strategy for sustainable development, also marked a leadership transition with Dr. Suleiman elected as president to succeed Dr. Tope Ushidari. And now to shed more light on this, we're joined by the newly or freshly minted president of the Nigerian Association of Resident Doctors, Dr. Mohammad Suleiman. Doctor, thanks so much for joining us. We appreciate you for coming on. I might argue that you're starting off your presidency or your tenure with the 30-day ultimatum that is now in effect. What are the measurable milestones or timelines that your association is expecting from the government within this 30-day window?
Thank you very much, Judith, and once again, good evening to our viewers. Following the annual general meeting, we've had myriads of issues. For instance, you talked about, or you highlighted, the issue of medical officers' promotion areas. This has been lingering for over 5 years, since 2020. We have the 25-35% commerce areas that has not been paid. This has been lingering for over 2 years. We have the accoutrement allowance that has not been paid for the latter part of 2024. This is over a year that these issues have not been addressed by government. Some effort was made, but these efforts are not really something to write home about, especially when you consider that in FTH Lokoja, for instance, because of casualization, 5 of our members have been sacked by the management there. And then stories upon stories upon stories. These are doctors that have been out of work for about, some even up to 8 months, 10 months, you know, without salaries. We also have issues of the youngest of the profession, house officers, who since 2021, we don't know the salary structure the federal government uses to pay them. These are doctors that get paid at the end of the month, and then they don't have a pay slip. For about 5 years, we don't know what is being paid. There are no pay slips. You don't have a way of checking this. There are other issues. For instance, government wants to address some allowances discrepancies, you know, some relativity concerns. And the government said it is known as the collective bargaining agreement discussions. This has been stalled because of the inability of the Federal Ministry of Health to make clarifications to the Salaries and Wages Commission, or the CBA itself, allowing for conversations to open up so that reviews can be made to allowances, reviews can be made to the existing commerce salary structure. A few weeks ago, we heard someone from Salaries and Wages Revenue Mobilization and Fiscal Allocation Commission come out in a matter of days, say federal government appointees are going to get 114% increment in their salaries. Doctors are talking about this review for a while, and a meager 1.7% was given. I mean, this is laughable and insulting, especially if you consider the fact that in 2014, when the federal government sacked 15,000 resident doctors for embarking on strike, of course, they eventually recalled all of us.
Right.
The number then stood at 15,000. This year, from the National Postgraduate Medical College, we have only about 8,000 resident doctors at the federal level. That is almost a 50% drop in just about 10 years. And then these issues are lingering over and over and over and over again. Right. It becomes very difficult for our members to continue to be patient, which is why the AGM decided to give the 30-day ultimatum.
Right. Doctor, I mean, from the standpoint, and just listening to the news, whether throughout today and even from last week, tensions are high. There are plenty of unmet demands, whether in the education sector with ASU or organized labor with Dangote and Pegason, or even with, you know, the trade union or the NLC. And now if you add the medical field, and this time the Nigerian Association of Resident Doctors and their demands, it means at this point, that, the government is stretched. So if they don't meet the proposed, demands, that if it's not met, what would happen? What would be the proposed industrial action by your association? Is it a total strike? Is it staggered, withdrawal or selective service disruptions? What are we looking at, given how critical our healthcare system is and, how important your association is?
We have doctors, Judith, who are dying from burnout, from excess work. We have doctors who find it very difficult to cope day to day. We have doctors who are on call, practically every day of the week for the entire month. This can no longer go on. Certain measures need to be taken. If these demands are not met, I'm afraid to say that NARD will not have any option. Of course, I will have to revert back to the National Executive Council for further directive, but it is looking like we are going to shut down. It is looking like there's no other option. Let me give you an instance. A young man died a few weeks ago in River State after a 3-day continuous call. And the federal government is giving excuses upon excuses over the years. The population of Nigeria is estimated right now by models to be closer to 300 million. I'm not really sure about that. But look at the doctors look at the figures I'm calling on people who look after these patients. Mistakes are bound to happen. These are mistakes that cannot be forgiven, even by one's conscience, which is why the association is standing tall to tell federal government, look into these demands. That is why we're also proposing that the federal government review what is known as the one-for-one replacement policy. If a doctor leaves today, the federal government should put measures on ground to be able to replace that doctor with the few we have available that are in Nigeria unemployed. If these issues are not sorted out, I'm afraid the National Executive Council will have to meet. And if they give myself, the president, the directive that you should shut down, Mr. President, I will have no option but to do so. Let me just emphasize one point.
Go ahead.
We need to be circumspect about how we treat doctors. Nigeria has not been fair to doctors in the last few years. Nigeria doesn't give you what you demand, deserve. It gives you what you demand, which is why the AGM said we must bring back the old NARD. In the last few years, presidents have been very diplomatic, have been engaging government so that these issues can diplomatically be settled.
Right,
government is not forthcoming, which is why the AGM said the old NARD must be back.
Now, Doctor, when we look at, demands, right, and whether or not, doctors have been, treated fairly, we can also make the same case for education as well. And we've seen the impact of that sector when it comes to strikes on, academic year and the students itself and the quality of education. And so we have to also talk about an impact of a potential strike if this 30-day ultimatum runs its course and your demands are not met. The impact on critical services like emergency rooms, maternal care, and even pediatrics units across Nigeria. How do you intend to mitigate the impact? Is there a plan in place?
I absolutely agree with you. I absolutely agree with you that the impact will be tremendous. Here we are talking about doctors as essential workers who provide essential services. I think the message should be that government should treat issues of resident doctors in Nigeria as issues of essential services so that we avert this impending cliff we're all headed towards. I have to say that it's painful, it's rather uncomfortable, it's unfortunate. In fact, some may argue there are morality or even legal questions attached. But what do you do when every appeal you make lands on deaf ear? You keep year in, year out, presidents have decided, let us be diplomatic, but you still come back to the table on the same issues. And it's rather becoming funny, like, as if it's drama, as if doctors are being taken for granted. Look at the theme of the AGM this year. We're looking at alternative means by which this country can keep its own doctors within the shores of Nigeria. That means we are ready to stay, we are ready to offer those services. Imagine, Judith, you have a doctor that has been on call for a whole week and you come in with malaria. Is it tenable that that doctor will be able to get the signs and probably fix issues for you? Chances are that mistakes will be made. I don't want to live with that on my conscience. I'd rather we face these issues head on. I'd rather the federal government comes to the discussion table so that we clear these issues. Let me tell you, the collective bargaining agreement has stalled in the last 2 weeks with no significant progress on any issue, on any front, simply because the Federal Ministry of Health has decided not to clarify one point about what is the relativity between the Commerce and Commerce table on a call duty table. Simply put, so that all these jargons are out, the Federal Ministry of Health is interested in making the call duty allowance for a medical doctor to be the same with other health workers. I mean, there's nowhere else in the whole world. The best of international practices does not.
And I'm glad you're bringing that, right?
That clarification, and we move forward.
Right. I'm glad you're bringing that very key point, because then in our begs to ask a question about, the other associations, medical associations, whether it's the NMA, which is the Nigerian Medical Association, Johosen, and even other allied unions. Is there a united front or solidarity action? Are you consulting with them for the case?
Absolutely.
So just clarify with us, what are the ongoing consultations? What's it looking like? Give us the details.
Well, the Nigerian Association of Resident Doctors is an affiliate of the Nigerian Medical Association. So I can tell you I'm constantly in contact with our leader, the national president of the Nigerian Association and Nigerian Medical Association. We are constantly in conversations with the National Association of Nigerian Nurses and Midwives. We're looking at, my predecessor has been in discussions with the Joint Health Sector Union, and then we intend to continue those conversations so that areas where we can agree, we agree. Areas where we have differences, we agree to disagree. It is the only way we can move forward. But that is not the meat of the matter, Judith. The meat of the matter is that we have sacked members in FTA local that needs to be reinstated. We have salary areas that have not been paid, some 2 years. We have allowances over a year. We have promotion areas over 5 years. We have house officers. Let me tell you, those house officers are not even in the scheme of service of Nigeria civil service. They've been excised out of civil service, which is why they don't have, in fact, right now, I don't know who pays them. Is it the Accountant General? Is it the Medical and Dental Council of Nigeria? They are passing the ball around on who should pay these very young doctors that are still in the prime of learning how to be responsible and mature doctors. I mean, what kind of a country do we live in that we have this kind of issues and we're not ready to resolve them? Right. It's time we come to the discussion table to solve these issues. Otherwise, in 30 days, I don't know what my National Executive Council will do. Yeah. If they give me a strike, I will have to prosecute it.
Doctor, I must say that, there's so much on the table in terms of unmet demands, and one has to ask whether this can be done in phase, whether, first of all, you treat one before go to the other, because doing all at once in 30 days, I do not know, I'm just speaking, just being fair here, if you're looking at it on both sides. But I must say thank you for taking out the time to join us. I wish we had enough time to continue with this discussion. Dr. Mohammad Suleiman, he is the president of the Nigerian Association of Resident Doctors. They have given another 30-day ultimatum to the federal government on unmet demands. Once again, thank you.